Hi, good morning. My name is Patience. I'm a first year student of nursing, University of Canberra. I started semester 2 in August. So I've always been interested in nursing as a child. I really admired nurses, starting from their uniform, from the way they behave, the way they are kind, the way they are eager to help and explain things to you, the way they generally made you feel very comfortable anytime you came in the hospital, even as a child. And that really attracted me to nursing. But I never got the opportunity to consider this as a career until late in 2011 in the UK, when my uncle got diagnosed with leukemia. I was able to interact with a lot of the medical staff, and especially the nurses. They were the kindest. They were eager to help. They would explain. They would show me trust strategies and techniques on how to help him, especially with when he was really depressed or when he was down and he wasn't eating. They encouraged me. They really made things very easy. Especially the ones that came out in the community, because in the hospital he was more anxious. I think generally because of the environment. But when we came home and the nurses visited at home to offer some community services, he was much more laid back and he was much more happy and able and willing to interact with them in a much more relaxed environment. And this got me thinking, after his death, about nursing career. I researched on the best way to get into it, since it wasn't my first career. And I decided to go through the route of support work. So the area of nursing I'm really interested in is a community nurse with a passion for mental health of the patients. So because I do believe that caring for patients outside the hospital improves their general well-being, especially caring for them at home. So I applied to several companies and I got one, and they gave me a lot of training in community nursing. And also the second company I worked with, Autism Initiative, also gave me some training with autistic spectrum. This has helped develop my way of communicating with patients. It has also improved my knowledge and willingness to get into this career. So in 2018, I moved to Australia. The first thing I did was to apply for the nursing program at UC, because I found out that they use top-notch technology, and I did a lot of research, and I find out that a lot of hospitals here also use technology to improve their practice. For my future, I really want to, for my professional future, I want to get a PhD in nursing, because I am passionate about the career, and I want to contribute my quota. And for my own personal ambition, I studied a master's in business administration, and that's because I want to contribute to the area of business. And also, as a nursing student, I know I would be able to successfully run a community services nursing package, and that's what I'm working towards as a person. And I do know that all I'm learning so far in the University of Canberra would help me achieve this and would make me a better nurse. And also my aspirations to go further with this course. Thank you for listening, and bye.